Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. So we are discussing about Graha Rogas. We have covered some of the portions. So now already we have taken a hypothesis that Graha Rogas are nothing but microorganisms in the present context. So we go forward. Now, there is one more important aspect. What Ayurveda says is about the Himsa, Rati and Archana. So they says the Grahas will attack your body. Now Ayurveda says why these Grahas will attack the body. The reason which is given is they attack the body with the purpose of causing Himsa. They attack the body with the purpose of causing, with the intention of getting Archana and also Rati. Himsa, Rati and Archana Kanksham. So these are the three important things why they enter inside our body. Okay. Now many of the times this is very difficult to understand if you don't know the basics. So what is Himsa, what is Rati and what is Archana? Now if you look into the microbiology and if you see what are the basic three important things that Grahas, microorganisms enter inside our body. So hardly there are only three broad topics. Number one is microorganisms enter inside the body to cause the tissue damage. Some of the microorganisms do not have any intention. They simply enter inside the body and cause some tissue damage, cause the problem and goes off. Some of the microorganisms, they enter inside the body with the purpose of completion of their life cycle. They want a definite host or intermediate host, indefinite host. So therefore to complete their life cycle, they enter inside your body. And some of the microorganisms, they enter inside the body to get the shelter. They want a safe area. They want a comfortable area. They want a nutrient-rich area. So broadly, if you are talking even in the microbiology also, they say that these are the three basic things. Sometimes they come without any intention, just cause the problem, injury, pain, etc. Sometimes they want to complete their life cycle, therefore they enter, and sometimes to get the food and nutrition. Now, same thing has been mentioned in our Graha Rogas also. They says Grahas enter inside the body with the intention of causing Himsa, Rati and as well as Archana. Now Himsa means torturing, pain, etc. So this is occurring in case of tissue injuries. Now you can see most of the viral infections which enter inside, the pathogens which cause the viral infections, so viral pathogens. So when they enter inside the body, they do not have any intention. See, a virus which is entering inside your body, it's only having RNA except some of the dangerous DNA virus like the hepatitis B or your COVID-19, etc. Otherwise, they do not have a DNA. Therefore, there is no question of replication. Okay, they only contain RNA. Okay, so they don't have the intention of getting reproduced. So why they are entering? They are entering without any cause. So they are self-limiting. They come and they cause the injury and go. That's all. They release some chemicals. Even they do not release the toxins. They release some of the chemicals. Okay. And cause a tissue injury and goes off. Okay. So some of the viral infections, viral pathogens, so they enter inside the body with the only intention of causing Himsa. Only intention of most of the upper respiratory tract infections, coronavirus, arbovirus, adenovirus, etc. Okay, rotavirus. So luckily, so they are not having a capacity of reproduction. Okay, they are very dangerous. Till then, although they do not have the capacity of reproduction, they use this RNA, reverse transcriptase, etc. will be there sometime, as in case of AIDS virus, as in case of hepatitis B virus, COVID virus, etc. Where that particular reverse transcriptase itself use the body cellular mechanism, chromosomal mechanism to get replicated. So they are so dangerous. But luckily, by the grace of the God, 99.999 viruses are only RNA virus. Okay. And as the generation passes, the mutation takes place and their capacity also comes down. Now anyway, so these viruses, they enter inside the body with the only intention of causing Himsa. There is nothing. So this is called as Himsa. They only cause the problem. Severe pain will be there. Severe problem will be there. Severe symptoms will be there. They cause much discomfort, isn't it? Viral infection. A patient will be bedridden in 1 or 2 days. In bacterial infection, patient is able to tolerate to some extent. Gradually it pick up. But viral infection is not like that. It's very sudden. Within 24 hours, the patient will be bedridden. So they cause himsa. So some of the grahas enter inside the body with the only causing himsa or some antigenic properties. So therefore, this is called as himsa. Some of the microorganisms, they enter inside the body not to cause the himsa, but they enter inside the body to want to complete their life cycle. See, this is one of the primitive thrust of each and every organism. What is that? Sexual. Sexual gratification or fulfillment is a primitive instinct of each and every individual, including the humans and including the amoeba. Okay, even the single cell organisms also, they complete their reproduction by different methods. Okay, maybe by asexual methods or pores method or gametocytes, etc. Now, some of the microorganisms, they enter inside the body in search of a host. They want a host. For example, you take malaria. A malarial parasite, it is not having any intention of causing malaria to you, but actually it is desperately searching for a host where it can complete its life cycle. So it enters as a merozoites, I think. Then it becomes a trophocytes, trophocytes into schizocytes, like that. And lastly, they become the gametocytes and enter inside the blood. So now here, that particular parasite enter inside the body to complete their life cycle. If it is not entering a host, its life cycle cannot be completed. So basic thrust of that particular parasite is to complete the life cycle. That is different, that it will going to cause the disease to the host itself. Okay, but its basic intention is not cause the disease. It is therefore completion of the life cycle. Many of the parasites and even some of the bacteria, so they enter inside the body only to complete their life cycle. So therefore Ayurveda says Rati. Rati refers to sexual manipulations. Okay, so Rati is called as the god of sex, Rati and Manmata. Okay, so now the word Rati is refers to some sexual appeasement or sexual, the gratification, etc. Now Archana. Archana means to be get worshipped or to get a pleasure or to get a comfort or a safe areas. Now many of the organisms, especially the bacteria, many of the microorganisms, especially the bacteria, they enter inside the body. Basically, you will be surprised. Basically, they don't have any intention of causing problem to the host. Host is gets affected because when they enter inside the body, the immune system of the host get activated and it will have a fight with that particular organisms, and as a result there is a battle. Because of the battle there is a tissue damage and then there will be a fever and other manifestations. Otherwise, suppose if the immune system is not doing anything, it is silent, so that the bacteria will silently come inside, do its work, and only its colonies will going to increase, then there will be a symptom. Anyway, bacteria when enter inside the body, most of the time they do not enter with the intention of causing the disease. Rather, their thrust is getting good amount of nutrition, because it's a question of survival. We know that bubukshitaha kim na karoti papam. Survival is the first thing, isn't it? If you are hungry, you are ready to do any papa, sin. Okay, similarly, it is a matter of survival to that. So to survive, a microorganism has to enter a host. It may be animal host, human host, or anything. Okay, so here also it is entering inside the body in search of a shelter. Okay, in search of a shelter, good nutrition, pleasant environment. Okay, and a safer area. Safer area means that area where immune system is not easily reachable. I will take example of tuberculosis. Now, tuberculosis is a deadly disease, we know that. But tuberculosis is an aerobic bacteria. So what is the main weakness of tuberculosis is, main weak point of the tuberculosis is it cannot live without oxygen. It always wants a high amount of oxygen because it is an aerobic bacteria. Therefore, tubercular bacteria always prefer to come into the lung where the perfusion of the oxygen is more. Okay, high oxygen supply will be there. That is also in the apex. See, apex is a more affected area in case of tuberculosis. Therefore, I say here tubercular bacteria is entering only for the purpose of getting good amount of oxygen or nutrition or comfort. It will cause a deadly disease because our body immune system try to prevent it. That is a different issue. That's the next stage, discussion on the next stage. But otherwise, it is coming with the basic intention of getting nourishment. Now, typhoid bacteria. Typhoid. So, it comes to the intestine because it want to take the nutrition. Many of the streptococcus, what is their intention? Their intention is to find a safer area to get a good nutrition and also to produce their colonies, their offsprings. Now, So these three things are very well explained in Ayurveda in the context of Graha Roga by telling that Himsa, Rati, Archana, Kanksha. If the Graha Roga is entering inside the body, only three causes are there. Some of them enter with the intention of Himsa. Some of them want to complete their life cycle, therefore they are entering. Some of them enter, they want a good nutrition, comfortable area and a safe area. Okay, so this is so beautifully explained in Ayurveda as Himsa, Rati, Archana, Kaksham, Graha, Avishyate. So this is one more important point that has to be discussed in case of Graha Roga. In the next class, we will meet with another part of the Graha Roga. Thank you very much.